guys, welcome back to Empower In. I'm Caroline Porter Thomas. Thank you so much for watching. So I saw a lot of comments recently about people that wanted to become nurses but they're scared of blood or they're scared of the other things that they might see in a hospital. And I just wanted to record a video for you guys because I really had no idea what I was getting into, and so I want to kind of tell you a little bit about my experience. Basically, when I started nursing school, all I knew was that I wanted to help people, and I thought that nursing would be a great way to do that. And I like putting smiles on people's faces, I like helping people feel better, and that was it. That was like the one reason. Had I really known everything that was encompassed as far as like how hard nursing school was, the things that we would see at the hospital, I might have rethought it, but I just kind of stuck with that one thing. Like, I really like people and I like to be around people, and that's it. In nursing school, it was quite an experience. The first time I ever suctioned a patient was quite an ordeal. What happened was my nursing instructor kind of left me with a nurse, and she was like, oh, the nurse is going to teach you how to suction a patient. I was like, okay, cool. So I was just like following the steps that the nurse was, telling me to do. And basically what happened was when you're putting the tube down the patient's trachea, you're supposed to, go down, and then you're supposed to put the suction on and go up slowly. But what happened was I was holding my breath, I guess, this entire time. I don't know exactly what happened, but anyway, something happened, and basically when the patient started gagging, which is normal, it's a normal, physiological response, I started seeing black spotches everywhere, and I was like, oh my gosh. And I've never passed out before, but I really thought that I was going to pass out. So anyways, I finished what I was doing, barely. I was starting to lose consciousness, I think, and I was just trying to pay attention to the nurse and do the steps. And as soon as I was done, I put everything down. I was like, I'll be right back. And she was kind of looking at me weird, but I was like, I'll be right back. So I was trying to walk out of the door, but at this point, there were more black spotches, and my sight was almost completely gone. And anyways, I made it outside the door because I really just didn't want the patient to see me acting like that. And all I could see when I got out the door was scrub feet walking, and I was like, please help me. And so the nurse saw me, and she helped me to the floor. And anyways, after 3 cups of orange juice later, I finally said, oh boy, I don't know if nursing is for me. This is rough. The other thing that I saw was the first surgery I ever saw was a C-section. Wow. that was a hard surgery to see, and I'm sure every surgery is hard to see, but that was really hard. Basically, I'm not going to describe it to you, but I was, in the room, and I had the mask on, and it's just a very similar experience. And I went home many times as, a nursing student, just wondering if I could really do this. And I was really questioning myself, and I questioned myself a lot. And I will tell you this, I know that, there's certain areas where you will see a lot of, different things, and maybe things that we think would be a little bit on the grosser side, but it's not every day, and you can choose where you want to work. So from that experience, I knew, well, I don't want to be an OR nurse. It's just not my thing. And, the other thing is, with blood and starting IVs, yes, it was really hard in the beginning, but guys, you kind of just get used to it. And one thing that really helped me was realizing that the thought of the procedure or the thought of the thing was worse than actually doing it. So if I thought about, starting an IV, or if I thought about doing a dressing change, it was actually worse than actually doing it. So I think when you're thinking about something, you're bringing up only the really gross or the really bad things, but when you're actually doing it, you're just thinking about steps. You're okay, first I do this, then I do this, then I do that. So it's more procedural, and you just get used to it. If you want to be a nurse, I wouldn't let this stop you, because it's really it's not even anything that I think about at all anymore. So guys, I love you. If you like this video, please give it a thumbs up, and more videos to come. Please post a comment. Let me know what you guys want to see next. All right, I love you. Bye.